Hey everybody, I wanted to do just a quick video on studying for the American Farriers Association written exams, both certified and the certified journeyman farrier. I think it's kind of well known within our industry that farriers are often not good test takers. We're more visual learners. Oftentimes we're not good readers. We don't comprehend well what we've read. And we also are kind of in agreement that drawing is a good way to study. But what I'm finding is that we're not oftentimes using the drawing technique to its full potential. And that's what I wanted to talk about. Recently at the convention, we did some studying there with candidates for the written. And when I had them come up and start to draw bones, I'd ask them to then label the joints. And I started having candidates say the fetlock joint, the pastern joint, the coffin joint. That's not what we want to be saying. We're studying for a test that's going to require anatomical terms. So we've got to force ourselves during this process to use terms and label terms that are going to be on the test. So we need to be using the proximal interphalangeal joint. So you get what I'm saying there. I don't have time to go through all of these. This is not me teaching you. This is me trying to help you study, all right? So when we're drawing tendons and ligaments, we don't want to just blindly start drawing these in. We want to use anatomical terms for their attachment. So if we're talking about the superficial flexor tendon, bifurcates distally of the sesamoid. So we want to use those anatomical descriptions of where that might bifurcate. Where does it go from there? Bifurcates again, attaches at the distal end of P1, proximal end of P2, collaterally. So you get what I'm saying there? I'm forcing myself to use those terms that are on that test, and I can't just say them. I need to draw these little arrows out, and I need to write them here on the side. Writing those things is still getting a picture in your head, and what we want to do is be able to recall a picture when we're there taking that test. If we're going to draw the main extensor tendon, for instance, where does it originate? The main extensor muscle, right? Runs down the front, which would be considered what aspect of the leg? Dorsal. We have an attachment at the proximal end of P1, proximal end of P2, extensor process of P3. So using those anatomical descriptions, drawing the attachments, labeling the attachments, labeling all of your joints. And now we don't stop here, because a major component of this test is pathology. And we can draw pathology. Drawing those pathologies helps us understand them and helps us recall those areas during the test. So if I'm talking about osselets, where does it take place? Metacarpal phalangeal joint. What are osselets? It's a bony exostosis. It's a process of osteoarthritis. What about high or low ring bone? Where do those occur? Use your anatomical terms. Proximal interphalangeal joint would be considered high ring bone. It can be articular, it can be non-articular. This is what you should be writing off here on the side. In just this little drawing right here, there's all sorts of pathologies that can take place, right? Carpitis, pop knee, wind puffs, osselets, high-low ring bone, pedal osteitis, navicular, podotrochleosis. Use all the different terms that you can think of. But if you're drawing those, labeling those as you go, that's a picture that's starting to be developed in your head. We can also picture words. And so then when you take your test, you can have a note sheet there. You don't get to take it with you at the end, obviously, but you can make notes. And what your notes need to be then are these drawings. So when you get to those questions that are asking you about these tendons, ligaments, pathologies, anatomical terms, you start to draw them and you'll start to recall them. A lot of people think that because of some of my accomplishments within the industry that I'm smart, and I'm here to tell you I'm not smart. I've had to come up with some of the craziest acronyms and different ways to help me recall and help me memorize these things. And so if I can take credit for anything, it's maybe just coming up with creative ways for me to study, or for me to help me recall these things. The other thing that happens is I don't retain what I've learned. So if I don't use it, I lose it. So that's up to you, or on you. Obviously here at Iowa State, I'm in a position where I'm going to be using these things to teach, so I'll remember them a little bit better. If you have to use those terms with your clients, use the anatomical term first, and then use the other term. So, the proximal interphalangeal joint, then say pastern joint. It's indicating two things to the client, both that you are very intelligent and you are able to describe that in a way that they understand. Makes you look good. So anyway, that's just a quick little video on how to study. Hope it helps, and I'll talk to you later.